So I look at our customers as everybody in the community. That includes not only the client I'm going out to see, but the law enforcement officers I may have contact with that day, fire department, the paramedics, anybody that I have contact with. So I can share a story where I went to see a client and the client couldn't get up to answer the door. Kept saying, I can't answer the door, and all their doors were locked. And they said, I really need help. I need help. I need help. So I called law enforcement. Law enforcement came out, and they were trying to find a way in. This client had all their doors locked, all the windows locked, so there was really no way for anybody to get in. So they called fire and the paramedics. They arrived, and they were able to get in through the garage and then get in through the garage door for this client. This client was stuck in the chair, couldn't get up, really needed medical attention. And so we had to work with all of them, got this person to the hospital to get medical attention, was able to get hold of a family member and work with them that the client really couldn't live alone, couldn't get out of a chair, couldn't get up to go to the bathroom. So it was a win-win. I mean, we were all successful. The family member, had some medical background from paramedics and fire and myself to know that they could now talk to their parent and say, hey, you need something more than this. So that was a happy ending. Obviously, if there's no answer, that could be an unhappy ending. But it's really rewarding to have that kind of a situation, to work closely with your community services, law enforcement, fire, paramedics, and successfully get a person to the hospital that needed it, who was still alert and oriented, and was able to get to the hospital before anything tragic happened. Those are the stories that you have to put away in your little chest of good stories, because you're going to have some that aren't good, and you're going to have some that are frustrating and you can't seem to get anywhere. So hold on to the good stories, put them in your little chest of good stories, and bring those out every time you feel frustrated, because you can't save the whole world. And as nurses, we know that. You can't save the whole world. You can't even save your whole community. So we do the best that we can, and we take out those stories and we share the frustrating ones with our colleagues as support.